Thank you everyone for attending today's virtual open house on the certificate in global health practice. At this point, you should be able to see our screen with the first presentation slide, and we'll be starting on time here in just a couple minutes. Hello, everyone. We will go ahead and begin the virtual open house for the Certificate in Global Health Practice. I'm Kelly Curtis. I'm one of the admissions officers here in the department. I would like to introduce Dr. William Brieger. He's the program director. Dr. Brieger, would you like to share a little bit about your background?
Hi, yes, I've been involved in teaching for quite a number of years, since actually 1976. Between 76 and 2002, I was on the faculty of the Department of Health, Education and Promotion at the University of Ibadan in Nigeria. And so much of my actual practical work in global health was based in Africa. And I got my DRPH at Johns Hopkins. So when I returned home from Nigeria in 2002, I became a full-time member of staff in the Department of International Health, where we're based now, and am affiliated with both our health systems program and our social and behavioral interventions program, and have been involved in online teaching through our department, through our Center for Teaching and Learning, since about 1996.
Thank you, Bill. So today's agenda will include an industry overview, program details, curriculum, faculty will be presented, and we'll share what online learning is like here at Johns Hopkins with over 20 years of online experience. You'll get a student's perspective. I will cover admissions requirements and financial aid. And there will be time at the end to address your questions. So if you have any questions throughout the presentation, please type them in the Q&A box. And Bill, this is your slide.
Okay, our chair of department, David Peters, has stressed quite often that trying to make a distinction between international health and global health is really not necessary. They are both terms that are used for the same concept because we're concerned about health equity. We take multidisciplinary approaches to address underserved people, understand the systems that do or don't serve them properly throughout the world. So we're concerned about local, national, international, and global levels to understand how health systems work. We're also focused on the Alma Ata Declaration, which was established by an international convention led by UNICEF and WHO in 1978. And their nations of the world called for health for all, trying to find universal approaches to reach people at the grassroots level, involve people in their own healthcare. And again, with global health, understanding the systems, the processes whereby this can happen effectively. So addressing these inequities within countries and across countries. Okay. So our department was the first academic department in the international health field, founded in 1961. And that's quite some time ago. But we are, what's that make it, 60 years plus. And we seek to understand health problems and develop feasible and affordable means of disease reduction, both communicable, non-communicable diseases, and health protection. And protection, of course, is that we want to ensure that health events do not bankrupt people, that health events do not disadvantage people even more. And we're concerned about underserved populations, whether they're in the inner city of Chicago or whether they, are in the rural areas of Nigeria. So the department as a whole achieves this mission by conducting research throughout the world, educating scientists and health professionals through programs like our OPAL programs, like our various master's programs. We even provide some training through venues like Coursera, in-service training in countries, also assist in policy development and learning lessons from public health practice, ultimately building the institutional capacity of countries to provide improved health for all, provide primary health care, strengthen their health systems. And so these are some of the links to more information about our department. Okay, so we have two main audiences. We are focusing, and we've had earlier in iterations of the certificate approach but from the beginning, since about 10 years, we've been concerned about early and mid-career people who are interested in gaining the advanced skills to either add global health to their existing job, to switch into global health, or if global health is an area they've gotten into, it provides an opportunity for in-service training for them to strengthen their existing work area. Okay, so careers are multiple. And it's interesting we bring this up because within about a month or so, we will have many people graduating, and that's one of the questions that we're always discussing in our what we call our live talks in our courses. Students saying, well, when I finish this program in a few months, where am I going to work? How can I get a job? I mean, some people are already in a job, but many people want to seek something new to use their global health skills. So there are a number of development agencies that provide assistance, like, for example, national-based ones like the U.S. Agency for International Development or the British Department for International Development. There are many NGOs that provide services in low and middle income countries. These may be based in Europe or North America, but also there are, of course, NGOs that are providing primary health care and other services in the low and middle income countries that are actually indigenous to those countries. And of course, we have people who are employees already of government organizations like ministries of health or military health services, whose scope of work does involve international work. It does involve strengthening health systems. And so they're the kinds of opportunities that people who do our programs can go into. And of course, there are global organizations and agencies. We have particularly things like UNICEF, World Health Organization, the Global Fund, UNDP. There are regional organizations like the Pan American Health Organization. So again, people that would be going into this certificate program, it's assumed that they would have had a basic training, a bachelor's degree minimum. Some people applying for it already have another master's. And so the certificate would be appropriate for them to gain these global health skills. And then once they have this, they would then be more competitive in these different career settings. Our department has many different branches within the department. In fact, our department is the largest in the school, and some people say it's as big as some schools of public health. We have, it's not mentioned here, but we have 4 program areas with their own heads or program directors. We have the social and behavioral interventions, we have health systems, we have human nutrition, and we have global disease control and global disease epidemiology and control. And then in addition to these 4 main academic program divisions, we have research and service centers. We have a Center for American Indian Health, a Center for Human Nutrition, a Center for Humanitarian Health, immunization research. We've been leaders in looking at mHealth, mobile health, how the extended use of mobile phones can benefit health system strengthening, benefit health education. So we have staff who have been working on that. Related to our nutrition work, obesity prevention, we have an Institute for International Programs that is particularly concerned with child health, with measurement issues of how do you determine the impact of interventions. We have 2 centers that deal with vaccines and promoting them, and we also have a Center for Maternal and Child Health and International Injury Research. So these are some of the types of things that are going on in our department, and indirectly or directly, the courses that we teach, expose you to some of the ideas of the staff working in these. Okay, so as you can see from the map, we have research awards throughout the world. 2020 has been an odd year because of COVID, but we've had somewhere around 200 different research grants each fiscal year for the past several years. And as you can see, focused throughout the world. And of course, that kind of experience may have been how you came in contact with Johns Hopkins and developed an interest in finding out what we're doing here today. So our programs try to equip you with the necessary skills to develop Sustainable solutions, sustainable interventions. We look at things that transcend borders. We're looking for things that will, of course, help solve problems in individual countries, but we want to find interventions that are more broadly helpful in low and middle income countries throughout the world. So our certificate is a 25 term credits. Each course can range from 1 to 4 credits. Normally we have at least 6 credits worth of courses, which on average is 2 courses per term. They're 4 terms. And the focus is on skills, gaining skills for working professionals. As we said, we do recruit people who have at least 2 years working experience, people who are early and mid-career, so that we're trying to provide what might be considered, in service or continuing professional development for the applicants. Everything is part-time and it's all online. As we were talking about earlier, our school in general and our department in specific has been offering courses online, and you can get degrees and certificates and diplomas online for the past 20 some years. Even with an online learning, you still have group learning, peer assessment, projects, and hands-on activities. We like in our courses for you to draw on your experience and to share your experiences among each other, to learn from each other, not just from the faculty members. Okay, this is an outline of the courses that are offered. We offer at least, like I said, 2 courses per term, and so that it's possible to complete this in 1 year. Technically, the university allows 3 years to complete a certificate. Generally, most people try to take 2 courses a term. It often depends on your demands of work and family. But so sometimes people will take 2 years and take 1 course a term, but the options are there. There are some introductory things that are expected of all students at Johns Hopkins. Everybody has to take the free Introduction to Online Learning prior to the beginning of their first formal course, so that you understand how the system functions before you jump into it. And everybody, again, has to do the course in academic and research ethics. So during first term, we offer seminars and fundamentals or an introduction to global health practice. We have, in the past, we've had a course on ethics. Right now, this has been the person is on leave who teaches that, so we have other options and seminars for that. And again, you have done the basic ethics training before you start off. We have a very interesting course on planning and designing of primary healthcare projects. These are community level, country level types of case studies that you learn the skills about that. Epidemiology is an important skill to understand the nature and extent of health problems. So we have a general introduction that is available to all students in the OPAL program. And then we have a specialized version of that for global health for our own certificate students. Statistical concepts, so you can understand how to interpret information that's presented to you in your agency and in articles and public health literature that you are reading, so you can make better use of it, understand the conclusions they make, and also a course in the social and cultural basis for community healthcare, primary healthcare program. So that pretty much comprises our first year. There are occasional modifications in some of the seminar courses, but basically the idea is that you can, if you full steam ahead, finish in the certificate in 1 year. We have a very large faculty. As I said, there are 194 full-time faculty. This varies every time we have a departmental meeting or a sub-department. These program meetings, there are always 2 or 3 new people being introduced. So we have people who are in your traditional professorial track where they do the teaching, service and research. We have people in the scientist track who are more focused on research, and the research associates who are also involved in those projects. There are quite a number of associate, adjunct, and other types of faculty who are based throughout the world. They come and teach occasionally. They are pulled into our online training. They serve as preceptors when students go out for various kinds of practicum for our master's programs. Again, we have a wide diversity. And overall, our staff, the support staff to administer and make the program run smoothly, all of our grants run smoothly, 205 of those. So like I said, it's the biggest department in the school. Okay, for the certificate itself, the courses, as was said, I'm the director. I'm assisted by Christina Salazar in our department. She actually, helped me pull together and develop the certificate and keeps track of, the academic requirements in the department. And so besides me, we have Gil Burnham, who is teaching the course on, and also together with Ambrasi Edward, the course on primary health care program project development. Alain Lebrique is our main person with the mHealth Center, but also he and Anna Karbachik are responsible for the global epidemiology. And then many other faculty are pulled in to give guest or specialized lectures in all of our courses. So as we mentioned in the beginning, our school has, we started our online training actually in support of programs for the Pan American Health Organization and CDC, some short in-service programs that later expanded, and more over the years, faculty started to put their course available online. So now you can get degrees fully online. We have a special center for teaching and learning that guarantees high production value for these courses and maintains assistance. So each of our courses, besides having the faculty, we also have a web developer who works with us to ensure course quality throughout. Our lectures are generally recorded, so you have the flexibility of listening in on the lectures whenever it's convenient for you. Some people, obviously do this after work on weekends. But that's the whole idea of, and it's also self-directed. Now it's within the scope of our 8-week terms. So eventually, one does have to draw an end to it. And we have assignments throughout each of the courses to keep people on track. But again, and we do have a few what we call live talks, so that anywhere between 3 and 6 of these live talks, which are spread out over a course. And this is an opportunity to hear in real time from faculty members and hold discussions among ourselves in real time. And then the Center for Teaching and Learning maintains a technical help desk because computers being what they are, the internet being what it is, people sometimes have some challenges getting online or getting certain things to work with certain browsers. And so there's always technical help that you can request. Okay. Courses have a variety of evaluation and assessment activities. There are number of, the most common thing, of course, is a short multiple choice quiz that grades itself. We have discussion forum interactions where people contribute ideas and comment on each other's ideas. We have step-by-step planning worksheets to produce case studies and projects. Participation is looked at in terms of live talks. Of course, we recognize that not everybody can attend the live talk at the time it's scheduled, and fortunately, those are recorded and archived for you to listen to at later dates. Some courses use short essays and problem-solving exercises, and more things that we come up with and hear about, we try out to make the learning more interesting. So Course Plus is our system of online learning. It was developed by our Center for Teaching and Learning. Each course in the school, whether it's a course given completely on campus, although in the past year there haven't been any courses on campus, which is why Course Plus is even more important. But it's a website for each course that provides all the fundamental links to reading materials, to what we put in our online library for each course. All of the lectures are accessible through Course Plus, all of the evaluation and assessment activities. Everything you need is on the web page or web pages for each particular course. And I'm going to give you an overview of some of the Course Plus features for our Fundamentals in Global Health Practice, which is our introductory course, just to see what it might look like. So you will get a Johns Hopkins ID, and with that, you can sign into Course Plus. And what happens is that when you do, you are presented with the courses that you've signed up for the current academic term. And so this, of course, is mine, and there are a number of courses, not that I'm taking these courses, but I'm either delivering the courses or as a guest faculty to keep oversight of what's happening in the different courses. So you see the courses, and then you would click on one to that you're currently taking, one or two, but you click on the one to get to that web page for the course itself. And then there's a general overview of the syllabus, the faculty, the objectives, the schedule, things like that. Some information on the assessment processes. All of that is in the overall syllabus page, as you can see across the right hand top of the page. There are syllabus content, communication, which is where you find our discussion forum and our live talks, resources, where you find our online library, help, which I just mentioned. If you do have challenges and problems, CTL can help you, and then the home page for each course. Okay. And then here is the home page. Each home page basically tells you the latest news. So what's going on in the course schedule. Here you would see if a live talk is coming up, what lectures have just opened up for you to listen to, what assignments may be due, discussions that may have been happening in the discussion forum, new things that have been put up in the online library. And then there's some quick links on the side. Any announcements that we put in are also up here at the top of the page. Okay. If you click on the content, that goes, week by week, lecture by lecture. We often start with the a list of live talks and when they occur. So for these, for the things in the content page, and then you start to see quizzes, and below that then are the lectures. So if you scroll down the content page, you will see all the different activities that are currently available for you to participate in. So if you click on lecture 1 or 2, then you get to the lecture page. If you click on the live talk parlor, which I have here, you can see the overview of what live talks are being offered and any handouts that go to the live talk. If you click on a quiz or any other kind of assessment activity, it'll take you to where you start the quiz, give you the instructions for those. So anything you need to be doing and that's available to be observed, to listen to, you can find on the content page. Okay. And then if you went to a specific page for a lecture, this is the lecture on infectious diseases, gives you the objectives, it gives you the reading materials or other resource materials that may help you understand that topic. And then the lectures themselves are found over here. It's called lecture materials. We can rearrange the pages, with different things, some on the top, some on the bottom. Usually, I like to put on a picture for, make the page more interesting. But if you look at the lecture materials, you can listen to the lecture by clicking the little orange arrow button. But what you can also do is download the MP4, you can download the PDF of the slides, you can download the transcript of the slides. So here is where you listen to the actual lectures. Okay. And this is an example of an assignment. This is a 3-part assignment where you have a worksheet, and you are each step of the assignment is explained. So this is the key thing. Every assignment would have a page explaining it, giving you the resource materials you need. For example, the country report template, what you need to actually write the assignment on. In this particular course, once you do step 1, it's analyzing a health and related problem in a country. People can choose among 3 or 4 countries, and then they do desk review of current reports, literature, surveys about the country, answer questions about that, and then submit that. We have what we call the Dropbox, where you upload your assignment. And in this particular case, then there is a grade book that we have that we can then return the assignment with comments to you and provide a grade. The grade book is additive, so that by the end of the course, all the quizzes, assignments, other kinds of laboratory exercises, whatever they are, each time a number is put in, and then you can keep up to date with your total for the course. Okay. We, as mentioned, have 24/7 technical help because people do, for various reasons, have access problems. The web pages may not appear as they should. It may be a question of your web browser. It may be another thing but basically our helpline is able to respond to this quite quickly. Then I think, yeah, if you all want to continue from there, I believe.
Yeah, thanks, Bill, for sharing the need for these skill sets, the quality faculty, and I think it was really helpful to kind of walk through Course Plus, the classroom, and see the different assignments and what that looks like. So I'm going to go ahead and cover admission requirements. We use an application portal called Sophos Express. It's where all applications are processed. We require a bachelor's degree from an accredited college or university, a minimum of 2 years of health-related work experience after your bachelor's degree, preferably focusing on low and middle income countries or underserved populations. You would upload a current resume or CV into Sophos Express, 1 to 3 letters of recommendations, and it should highlight your compatibility with the program. Your statement of purpose should show how your educational and career goals align with the objectives of this program. And for our international students, you may need to show proficiency in English. And any education earned outside of the United States must undergo a course-by-course evaluation. We recommend using WES or World Education Service. Applications are reviewed on a rolling basis. So as soon as your file is complete, it will go over to the mission committee. We do encourage candidates to apply early. The final deadline to submit your application is July 1st to start August 30th, and we have one start every year in the fall. So it looks like tuition for the upcoming fall term is going to be $1,233 per credit hour. The Opal Scholarship of $474 per credit hour is awarded to all accepted students. After the Opal Scholarship is applied, the student's cost is $759 per credit hour. And with 25 credits in this program, your current investment would be $18,975. Students pay for the credits or the courses taken in each 8-week term. So again, there is no additional forms or application steps to receive this Opal Scholarship. It is automatic for those students who get accepted into the program. Beyond the Opal Scholarship, the Financial Aid Office does assist with federal and private loans. You can see the contact information for the Financial Aid Office. So if you haven't typed in your questions, please do so now. We will try to address all your questions. Some questions, though, may be better answered by reaching out to you directly. Does anyone have any questions? I know it's a very detailed presentation. So Bill, it doesn't look like there's any questions. You have the contact information up on the screen if you do have questions later on that our admissions team can answer. Bill, do you have any closing comments?
Just to be sure that people can contact us, I think, I don't know if, well, Kelly's email is there. I'm not sure if my email was listed in the beginning. We might type that out somewhere, but I'm not sure where.
You know where it's located? On the website under faculty, your contact information is listed.
Yeah, so don't hesitate to write to me. We are working toward getting the application process wrapped up. It's certainly not the deadline yet, but it's getting close. So we encourage people to be thinking about it. If you have any questions about that need answering to help you make up your mind, do get in touch with us soon.
Yeah. Any kind of application questions, we certainly could answer in the admissions office, and Bill is easy to reach on the faculty tab for more detailed questions on the program. I want to thank everyone for attending today's virtual open house. Again, if you have questions or if you're excited about starting your application, please do reach out to us here in the admissions office, and have a great rest of your day.
Thanks for joining us. There was one question about finance.
Oh, I did not see that.
Yeah, it just popped up.
Oh.
We didn't talk about the cost. There is a per credit cost. The people in the Opal program do get an automatic discount compared to our other programs. So it's sort of an automatic scholarship. It may not be the, there still are costs, but so you would pay for 25 credits worth of coursework, and I'm not sure what the current each year the tuition cost changes, but it's approximately $1,100 a credit at present. But we
Yeah,
don't.
thank you, Bill.
More than, so that's less than what students pay in the MPH program or pay in the PhD program.
Yeah, and that information is also available on the website, and the admission team can send an email with that tuition and partial Opal scholarship information in it as well. Any other questions that you can see, Bill?
Somebody wants to know if the recording will be available later. I think you do put these up on the website.
Yes, it will be up on the website, and then we'll update the link to the recording in the email that we send out to students when they request information. Any other last minute questions? Well, again, thank you, everyone. We look forward to hearing back from you, and have a good rest of your day.